This is no exaggeration. Timely newborn screening can make the difference between life and death for every precious baby. Those few drops of blood you collect in a heel stick are the key. You will have actually started the process weeks before the baby is due when you talk to the parents about newborn screening, and you will repeat the education at the time of the draw as well. Then, 24 to 48 hours after the baby is born, you'll collect the samples. Here's what you'll need for the procedure: the newborn screening collection form, a heel warmer or a warm, moist cloth, an alcohol pad, gloves, a heel lancet, sterile gauze pads, and a Band-Aid or two. So first, fill out the newborn screening specimen collection form. Be careful to write legibly. If the lab needs to reach the family immediately, the name and phone number must be clear and easy to read. Fill in all the information. Put on your gloves so you don't get lotion or other oils on the baby's skin. Have the mom hold the baby on her shoulder. Then place the heel warmer or a warm, moist cloth on the heel. This will bring more blood to the area. Follow the instructions on the heel warmer for how long to leave it on. Select the safe area of the heel on either side for the puncture. It's called the safe area because it reduces the risk of puncturing a tendon or bone. This area also has larger capillary blood flow. Wipe the heel with an alcohol pad or cotton ball. Let it air dry. You don't want wet alcohol to contaminate the blood specimen. Stick the heel with the lancet and wipe away the first drop of blood with a sterile gauze pad. Then, when a large blood drop forms, lightly touch it to the filter paper. If one drop completely fills the circle and soaks through to the other side, that's great. If a second drop of blood is needed to fill the circle, take care to make sure the blood drop is not on top, as this causes layering. The baby may let you know that this isn't the most fun they've ever had. Mom gets some early practice at soothing, and it only lasts a few minutes. Move on to the other circles and fill them. This often goes quickly and easily, but sometimes you'll need to keep applying gentle, intermittent pressure on the heel. Fill the circles one at a time. Do not go back to partially filled circles to add more blood. This causes layering, which can prevent accurate lab results.
The newborn screening dried blood spot card typically has 6 circles that need to be filled in completely. The reason this is important is that just for that initial testing, the laboratory will punch a hole in that dried blood spot 9 or 10 times in order to get that result. So they punch the hole with a mechanical punch. That resulting piece of that dried blood spot card is what is used for the testing.
When you've filled all the circles and checked that the blood soaked through to the back, place the specimen form on a clean surface while you apply a Band-Aid to the puncture site. Allow the blood spots on the card to dry completely in a horizontal position for 3 hours. Some states provide a drying rack and a bag to carry the form back to your office. Just make sure it is lying horizontally, doesn't touch other specimens, and avoid temperature extremes. Excess heat can affect results. When it's dry, you're ready to get it to overnight mail or a courier to deliver it to the lab. Be sure to call the family with positive or negative results, and know that you've done something really important for that baby and its family.